Right, well, let's stay with vaccines, but a slightly different focus. Our rollout may have ground to a temporary halt, but when it resumes, and it has to, it will be a massive logistical rollout. Millions more doses are due to arrive in the coming months. Some require storage at much colder temperatures than the Astrazeneca vaccine. It's a logistical challenge of epic proportions for any government. We've seen how even the USA, a developed country with many resources, has battled. Now, FedEx is one of the major international courier companies transporting vaccines globally. And to tell us more, I'm joined by Jack Muse, Regional President for FedEx Express in the Middle East, India and Africa. Jack, thank you very much for joining us. I was wondering if you could just start by giving us some context on how FedEx is helping to move vaccines around the globe at the moment.
Sally, I'd be glad to. FedEx, on average, moves about 18 million packages a day. So that's a large network by any measurement. So what we are doing right now is working very closely with governments and manufacturers of the vaccine in order to ensure that they move safely and effectively around the globe. In the United States, where we've been very active in moving vaccines, we moved the first vaccine from Grand Rapids, Michigan into Boston. So we stay focused with the manufacturers on what sort of packaging they need to make sure the vaccines stay in comfortable temperatures and are good when they arrive. And we also work with government agencies to get them delivered where they are promised to be delivered at the time they're promised to be delivered.
Are you speaking to the South African government about helping transport the vaccines here?
Absolutely. We are speaking to governments around the world, and we are specifically speaking to both the government and the manufacturers in South Africa to ensure that if they need our services, we're there and ready to support them.
So will you give them a good deal?
Yes, we will make sure that it is an effective movement of the goods in the country, that we get to the areas that they're needed most, and that they get there with the vaccine being fresh and ready to use.
So, of course, one of the big challenges, particularly with some of the vaccines, I think it's the Moderna and Pfizer, they need to be kept at extremely cold temperatures. How much more difficult does that make the moving challenge?
Well, the one advantage that we have is speed. So we make sure, we connect about 98 to 99% of the world's GDP in 24 to 48 hours. And so what we focus on when we're working with the manufacturers is what kind of packaging they're using. And the packaging ensures that the product remains viable for a period of 72 hours or more, depending on the product. Consequently, with the speed of our network and the ability to get it anywhere, door to door in the world in that speed of time, we can make sure it's serviced. But we do contingency planning as well. We look at how we can remediate the shipments if needed, and addressed by the manufacturer that they want us to, and that means re-icing them if they're needed or putting them in cold storage if they're needed. And so we've located those cold storage units and re-icing units around the world so that we can make sure and support the manufacturers and the governments as these products roll out.
Of course, your experience, I'm sure, would be very valuable as we start to roll out our vaccines. What are the big lessons that FedEx has learned around this particular rollout? Because it is a massive logistical challenge, and you're a company that works in logistical challenges, but I would imagine this is probably one of your toughest challenges.
Yeah, I mean, it's obviously one of the most important things that we as a company have been doing over the last 47 years of our existence, to get the world back in sync again, to beat this virus. But at the same time, we've been doing it for 47 years. As I told you before, we're moving 18 million packages a day. So there's constant challenges that we face every day and that we overcome in order to meet the needs of our customers. So the one thing about this product, I think early on they estimated that it would take 1,000 747s worth of capacity to move this product around the world. Just to give you an idea of the size, that's about 1 week's worth of our capacity. That's 1 week. And so we know this product is going to be moved out over periods of several months. So I want to assure the public that we have capacity to support the governments and the manufacturers in delivering this vaccine where it's needed. And so beyond that, we want to make sure that we're coordinating with the governments on where it's supposed to go so that we get it there in a timely fashion.
Yeah, exactly. I mean, it does also rely on your government or your health service providers knowing exactly what they want, because if they don't give you a clear brief, you can't deliver on that. Is that perhaps one of the bigger challenges?
I think the government's, the one thing that we've seen is they're starting to coalesce around a process of communicating with the suppliers, whether it be the manufacturers or whether it be the logistics providers like ourselves. But yeah, so when we go in to talk to the governments, we ask them how many doses they're going to be distributing, where they want them to go, and when they're going to be ready for pickup. So South Africa has some production capability within the country, so there could be some domestic movements of vaccines. And obviously with the Astrazeneca that you were discussing, there's movement internationally. We can support on both fronts. We can support a vaccine coming in from an international location, and we can support a domestic movement as well.
Well, thank you so much for your time. Really great to chat to you. That was Jack Muse, Regional President for FedEx Express in the Middle East, India and Africa, confirming to us this evening that they are indeed in discussion with the South African government to assist with moving our vaccines around the country.